Hi everybody, my name is Viviana Antimo. I am a senior double majoring in neuroscience and sociology with a minor in psychology. And we would like to welcome back to Raise Your Voice 2024. As we continue our day of collective growth and learning, I'm excited to introduce our next workshop entitled Public Policy in the Indiana General Assembly, What You Should Know, presented by Beth. Remember to take care of yourself, take breaks, and grab snacks as needed. Elizabeth Beth White is currently the president and CEO of the Indiana Coalition to End Sexual Assault and Human Trafficking. Most recently, she was the executive director of the Greater Indianapolis Progressive Committee for nearly 6 years. White is deeply committed to public safety, advocacy for children, and voting rights. She has an extensive history as an elected and appointed official and previously served as a chief legal counsel at the Marion County Office of Family and Children Deputy Prosecutor in the Marion County Prosecutor's Office. White received her BS with high distinction from Indiana University Bloomington and her Juris Doctor with honors from the Georgetown University Law Center. She is a member of the Indianapolis Bar Association and associate faculty member at IUPUI O'Neill and is an active member of Central Christian Church. White lives in Irvington neighborhood of Indianapolis with her husband and son. So please welcome Beth White.
Well, good afternoon, everyone. It is wonderful to be with you. It's a beautiful day on a beautiful campus, and I'm just really thrilled to be here. I want to introduce you also to Alexis Moore, who is one of my colleagues from the coalition. She drove me up today. She's going to drive me home, or I'm going to drive, or something's going to happen. I'm going to use this, and I think it's going to work. And I'm also going to walk around because that's what I do, and I want to make sure everyone can hear me. So if there is ever a point, at any point that you can't hear me, then I will go to the microphone. But it is just easier for me to walk around a little bit. So you heard my bio. It's long, and I'm kind of old, so we'll just jump right in to our agenda for today. I've been looking over the materials of your program today. It's just a wonderful day. I'm really envious and appreciative of everyone who put together this important program. Where's Liz? There's Liz. Hi, Liz. Liz, she's the best. Let's thank Liz. Thank you, Liz. Liz and I have only communicated by email, I think, so I don't know if we get a chance to meet her. We're going to talk today about public policy. In the state of Indiana in particular. I know you've had a lot of discussion today about the problem. You're going to hear a great student panel this afternoon, also an advocate, which I'm really sorry we can't stay to hear. And then this evening you have an excellent keynote speaker. Kim Worthy, I think it is just a leader in this movement. And she is a great kind of example of what can be done in the public policy area in this important topic. So I'm sorry we aren't able to stay for her, but you all will really be impressed, and we're going to lay the groundwork a little bit for what she's going to talk about this evening. Why should we care about this? What's going on in Indiana? I think you probably already know, but we're going to remind ourselves. What are some solutions that we at the coalition have been working on? And there are lots of them. I won't say that we're making great progress, but we are working on them. Just a quick minute about the coalition. The coalition is a umbrella organization. We work with the service providers around the state. And this afternoon you have Jessica Castillo Richmond. She got married and hyphenated. So Jessica Castillo Richmond from the Family Justice Center here in South Bend. They are one of our service partners. So we provide technical assistance training and advocacy on behalf of all the service providers around the state. So that's our job and our role. And so I'm going to talk quite a bit more about that. And if we don't like the state of the state in Indiana, which I think most of us don't, because it's not good in all kinds of ways, then we're going to talk a little bit about what we can do. And I want to leave time at the end for questions, but I also want to make sure that you all stop me anytime at all to ask me anything or even make comments if you'd like to do that. I don't want really to discourage discussion, because that is a useful tool for us today. So what is public policy? Well, an issue. And of course, today we're talking about sexual violence in particular. Some other definitions include the principles, which are often unwritten, about which social law is based. So social law is confusing to me. I'm a lawyer. So we have the law, and then we have sociology, and they're not the same. They obviously intersect. But I think what they mean by this in the dictionary, social laws, being the laws that govern behavior, which, by the way, they mostly all do. Institutional proposals, I'm not going to read this to you. Laws, regulations, blah, 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 right? This one looks like it was written by a lawyer. So that's, we get paid by the word, so there you go. Systems of laws, regulations, all of that. So there's a lot to that. I'm going to try to break it down very quickly. So we've got a problem in Indiana, and that's a problem of sexual violence. I know that you've been talking about it all day, and I'm not going to reiterate too much. We are above the national average in everything from girls in high school who have experienced rape in particular. We are higher than the national average of women in the state who have experienced some sort of rape. Sexual violence is increasing and getting worse. We have seen dramatic increases in interrelationship violence of young people. No one's really quite sure why that's true. It's been true since the pandemic. I think the sociologists and people a lot smarter than me are going to have to figure out why that's true. But we've got a problem in Indiana. And I think we can all agree that we want to do something about it. So, what are the solutions? Well, what government does and does not do. Now, government's not the only participant in this situation. Our schools, K-12 and higher ed, have a role to play, of course. Our healthcare environment has a role to play, very important role, actually. But government in this particular case is what we're going to talk about today. What are the mechanisms? Well, there they are. I want to highlight. Does this little thing let me point at things? I'm kind of excited about the opportunity. Oh, look at me. I can do it. I'm capable of learning. Look at this. Okay, so I'm going to talk. I want to focus on this funding priorities concept, right? Because, all of you, of course, have a budget, whether you think about it that way or not. I've been a member of my church's board of trustees for many, many years. We put together the budgets. Budgets are moral documents. They are not financial documents, they are moral documents. And the way we evaluate what's important to us is how we spend our resources. And that is something that we in government need to think a lot about. Because when we think about what are our funding priorities, that really does tell us what's important. So, how are we doing? Well, we're not doing great. I said that a minute ago. But first, let's talk about some words. Sexual violence and sexual assault are two kind of words I use interchangeably. Sexual violence is more of an umbrella. And so it does encompass things like child abuse, incest, intimate partner violence, and also human trafficking, human sex trafficking, which is something that my organization is tasked with trying to develop policies and do some intervention around that. So these are not legal terms. I know that later on this afternoon you're going to have a deputy prosecutor come and talk to you, which I think is wonderful, and she will probably use different terms because the statutes in Indiana, laws that are passed by the legislature, evaluate crime in very specific ways. These are some of the ways. Oh, I did it wrong. I was trying to point, and then I just advanced. That's not right. Okay, here we go. So these are some of the ways, right? And these are the words that are used in the state law. But when I talk about the problem as an umbrella, I use the term sexual violence or sexual assault. So I just wanted to make sure we follow that. Rape is a form of sexual assault, but it is not the only one. And in society sort of at large, we think about the term, we think about rape, and then sometimes we think about everything else. But rape is only one category of sexual violence. The other thing I want to focus on, or just remind myself actually as I'm talking to all of you, victim and survivor are two words that are used somewhat interchangeably. Victim is the word that the state law uses. The deputy prosecutor will talk about victims. Law enforcement will talk about victims. Always, no matter if it's been last week or 10 years ago. In the movement of sexual violence intervention, which is what I do, we try to talk more about survivorship. We don't want to label a person based on what's happened to them. It is about being a survivor, moving past what's happened to you. And so we use the term survivor. And it gets confusing because people aren't really sure what you mean when you use those two terms. But I will sometimes use them interchangeably. But survivor is a more empowered word. And so we try to empower people who have had this experience but are moving past the experience toward the healing that they need. And then gender specificity. I tried really, really hard to be very clear. Anybody that can be the victim of sexual violence. anybody, male, female, non-binary, transgender, anybody. And so when we talk about the victim she and the perpetrator he, that is limited. And so we really want to make sure, at least I'm reminding myself, because this is a hard one for me, it's just easier to say, you know, the survivor she and the perpetrator he, or the criminal he. But that's really way too limited. So, 1 in 5 women in Indiana, I think that statistic is really quite low. What we know about sexual violence, the vast majority of people never disclose. Not to anyone, not to their family, not to a police officer, not to a friend or confidant, not to anyone. So when we see 1 in 5, we say, well, that's the people who we know have disclosed. So we believe it is much, much higher than that. We are really bad for girls in high school who are raped. We're also bad for males who are raped in high school, which is obviously a very troubling statistic. So we have a problem. So what are we trying to do about it? Before I move on with my solution discussion, which I think is hopefully the more hopeful thing, I want to know if anybody has any questions for me about any of that, or anything, actually. Nope, all right, okay. So when we work on policy changes in government, I have kind of put our work in particular in the last, I've been in this job for 2 years. Before that I was a not-for-profit leader, before that I was an elected official, before that I worked for a mayor, before that I worked for the governor, and before that I was a deputy prosecutor and the chief counsel at DCS. So I've had a lot of experiences that have kind of led me to this job. But in the 2 years I've been there, we've been much more intentional as an organization about our public policy advocacy. It is true to say that victims of crime don't have much of a voice in the legislative environment. Now, some would say that law enforcement is supposed to be the victim, the voice of the victim. Sort of. There's more at work there. So we really do take seriously our responsibility for survivors. The other thing to say, of course, and I think many of you know, who do this work or know this work, is that we are reminded constantly that reporting to law enforcement is something that the survivor must decide for themselves. And we get very nervous, very fast, when members of the legislature say things like, well, we'll provide this funding or this resource if they report to law enforcement, right? That is an absolute stopper as far as the conversation that we're having with legislators and others. Does anybody want to raise their hand and tell me why you think that's true? Why that's our policy position? I'm going to tell you in a minute, but I just thought maybe you want to weigh in. Why would a victim not want to report to law enforcement? Please.
Like social stigma.
Social stigma, if you couldn't hear that, absolutely true. Why else, please? Correct. Re-traumatization, yes, very good. Please.
Distrust in the system.
Say again.
Distrust in the system.
Yes, absolutely true. The system, tell me what you mean by the system. I think I know, but I want to hear it from you.
The law enforcement process, what they're going to do, what they're going to say, what they're going to tell people.
Right, what they're going to be subjected to, all of that. Please.
They won't believe you.
Yeah, not being believed. Absolutely 100% true. What else?
A lot of work. 50% of cases are prosecuted.
Right, a lot of work for maybe not much kind of reward is the wrong word because you never feel as a victim like you're being rewarded. But it's a lot of work for what may or may not be the kind of satisfaction at the end of it. I've been a lawyer a long time, and I have a lot of friends who come to me like, I'm really mad about this. I'm going to sue. I'm going to do this. I'm going to do that. Well, here's the news flash. It's going to take a long time and cost you a lot of money, and you will probably not get what you want. And when you are the victim of crime, that problem is even worse, right? So all of these are reasons why survivors don't come forward at all, right? And in a lot of places, and specifically, the other thing I'm going to add to that list is depending on where you are and who you are, that interaction with law enforcement is going to be very scary and not very confidential. Wherever I go in this job, and I go a lot of places, people tell me their stories, right? And it's a great privilege to be the recipient of those stories. And I had a young woman, it's been about a year ago, and she said, I was raped in high school, and it was the son of the football coach, and the football coach's brother was the police chief, and all the detectives were like my uncles and his uncles and the whole thing. Notice I said uncles, right? No female in law enforcement anywhere in the environment, right? Do you think that young woman is going to come forward and tell her story to anyone, let alone law enforcement? No, of course she is not. It's a very scary thing, and you don't believe that your behavior is what becomes scrutinized. Right? So these are all reasons why not only victims don't come forward, but they also don't want to report to law enforcement. The other thing about sexual violence, and many of you know this already, but I think it bears repeating, is it is about violence. It's about power and control, right? And so what happens is that the power and control of your bodily autonomy has been taken away from you. And so what we want to do for a survivor is have them regain some of that power and control. And when they go to seek help and someone says to them, this is what you have to do. You have to go to this place and talk to this person and tell your story maybe 3, maybe 4 times. Maybe the law enforcement environment is not very trauma-informed, and maybe they'll say things like, what were you wearing? What were you drinking? Did you know him? All the things that we've heard a million times, right? And so that is not control for the survivor or for the victim. That is further telling them, dictating to them what's going to happen. And so victims need to regain the power and control about what's going to happen to them now and what they need from their healing. And saying that they have to go, likely talk to a man, likely be questioned a lot about their own behavior, is not very trauma-informed. Are there questions? Please, please, please.
So, if I understood you, you said often the legislators want funding tied to or to law enforcement.
Yes.
And what is their?
Well, they will say things like, if people don't report to the police, we're never going to know how big the problem is. We're never going to catch the bad guys and put them in prison. Because, you know, I mean, I'm not a law enforcement officer, but I was a prosecutor, so that made me kind of law enforcement. And you know, I'm not being flip about that. Like, that's real. And the notion that you become a police officer to catch the bad guys and put the bad guys in prison so that people are safer, right? It's a very kind of linear, transactional way to look at the work of law enforcement. And it's not that simple ever. I mean, maybe it is about things like auto theft or, you know, other kinds of crime, but in this particular case, it's just not that linear. And so that's what they say. We have to incentivize, they don't use that word because that's a big word. And in our legislature, someone once said to me, you gotta just use small words and use hand puppets because our legislators, not so much. So incentivize is not a word we use, but they will say the only way we're gonna catch the bad guys is for people to report. Please.
I want to just make sure that we clarify that that is not how our state is for sexual assault crimes, for sex crimes.
That's correct.
Yeah, so I just want to.
You mean Indiana?
In Indiana, you do not have to report to get your entire
Complement of services.
at the hospital level.
That's
The
true.
hospital level, but the state isn't legislating any dollars to schools.
Oh, yes, yeah.
We get a small amount of sexual assault victim assistance funding. There's federal money that flows through the state. And they don't, when I'm in the legislature, I'm generally not talking about this victim gets this service if they make a report. We're talking about the notion of changing the environment where people don't have to report. And yeah, I mean, it's a philosophical thing. It's a good question though. Please.
Yeah, I just think there's some nuanced things too that, you know, grants and other kinds of things get developed, and as much as they want to be victim-centered or trauma-informed or whatever that is, they still have to like report this is how we're using that money.
Correct.
And so oftentimes, like maybe that data or those numbers to support the fact that we're being good stewards
Correct.
of the, you know, and so
Correct.
it's these things that may have good motivations, but it's just not serving the survivor as well as they could.
Yes, very good. If you couldn't hear that, I want to say it again. There is nuance to this in that we want to make sure that the resources are being used properly, and that we want to be able to report the way the resources. Do you work in the environment? Do you, sir?
I program manage Shuttle Line for Third Aid.
Wonderful. Thank you for that. Yes, that's all true, and that's real, right? Our survivors, including us, by the way, we get federal money, we get state money. We have to, we have to tell the regulators and also the legislators how we spent that money. That's absolutely true. And believe me, I would like better data also, but that balance of not requiring reporting in order to get better data, right? That's what we really want to be careful about. And legislators, nuance is also not a thing that the legislature does very well, right? That whole sort of, oh, well that, you know, they are very concrete. This money is going out the door. I want to know what the money is being spent on, and I want this number of people that I can identify, by the way, not by their name, but like age and all this, you know, where they live. I want to be able to identify them, and that way we can have a better handle on the problem. So the motivations aren't bad. They're just different than those of us who work in the serving of victims. So thank you for that, and thank you for that question and your input. Who has other questions for me? Okay, very, very good. All right, let's move on. So these are the three categories that I've sort of looped our work into. Do we have resources? Number one, always. Do we have the resources sufficient? And by the way, we don't. Just by the way. Indiana is not great. We're getting worse because the problem is increasing and the dollars are not. The dollars are actually going down because of some federal funding that we can't control. Are there structures in place? Structures in place to ensure the work is coordinated, victim-centered, and trauma-informed? That is the question. And then are the laws victim-centered, right? Do the laws that have nothing to do with funding, do they respect these issues we've been talking about? Survivors need not to disclose, or not to have to go to law enforcement, or not to have to put themselves through those kinds of systems. So these are our categories. Just very quickly, we're going back to high school civics, just real quick, because it's so fun. I love it so much. So we have a legislative branch, right? The Indiana General Assembly, the second one is what we like to point is the one we're going to talk most about today. I use the term legislature and General Assembly interchangeably, so don't get confused by that. And then we have an executive branch, right? And in this work, we are dealing primarily with the Department of Justice. We get some rape prevention education from the CDC, or the Center for Disease Intervention and Prevention, is actually what they call themselves. Center for Disease Control and something or other. I don't know, the federal agency that deals with all of that. Health and Human Services, obviously. State government, we have the Criminal Justice Institute, which is the pass-through of most of our federal money, actually almost all of our federal money. And then Family Social Services, of course. DCS stands for the Division of Child Services, right? The Child Abuse and Neglect. I was chief counsel of Marion County one for a number of years. It was horrible work. I admire people. Anybody that's remember worked at DCS? You have, God bless you. Tell me where. Say again? In Allen County. Anybody else? Yeah. It's really, really hard. Did you find it hard? What kind of, were you a caseworker? Yeah. Permanency, relative support. That's different between investigations. Permanency is the notion we figure out what the child abuse services needs and then seek a system that serves it. Really, really hard. So these are just some things that I want to remind ourselves of who we're talking about when we're talking about interacting with our government. There's also a judicial branch, which we're not going to talk about at all because it's too complicated and doesn't play that much of a role in this space. Some of the solutions, talking about resources. Yeah, federal funding is the vast majority of the kind of money that we are receiving in Indiana, and it is a problem. And it's a problem for all kinds of reasons, and I kind of listed them here. VOCA, the Victim of Crime Act, is the main funding source, and it is in trouble, just as a funding source. Alexis, how am I doing on time? Okay, I think we're okay on time. Good. So, VOCA was established in the early 90s when Violence Against Women Act was passed by then Senator Joe Biden, who of course now is our president. And it was established in such a way that the source of that funding is white-collar crime settlements into a pot called the Victims of Crime Fund, or VCF. Now, that makes legislators really happy because they love to say that they did not spend any tax dollars on this problem. But what is the problem with using a source like that for funding? Who has a thought about that? Why is that a bad idea?
It's not a stable amount of money.
Correct. It's not stable. Right. It's not predictable. It's not very sustainable. And what happened when our previous president was elected in 2016, the Department of Justice made less of a priority white-collar crime settlements. And I will not opine about why that was true, but that's what happened. And so we saw the fund just, become, the fund balances were less and less, and it became a real problem. Now, since then, it's been, improving a little bit, but again, the verities of that particular source varies wildly. and it is just not sustainable. We can also talk, if we want to, about sort of the ethics of an essential government service being paid for by someone other than the government, right? It doesn't feel great. There are logistical reasons why, but also I think kind of fundamental moral reasons why. I mean, we don't make law enforcement worry about whether they're, they get the guns in the cars and the whole thing. But victim services, at risk. So VOCA is a major issue. We are expecting a 40% cut in the next biennium, which will start in 26. And we are telling our programs that they need to prepare to have about a 50% cut, and then maybe the fund will become insolvent. And I've been doing a lot of work around preparing our programs. I'm doing some advocacy in Washington. We have an umbrella national organization. They are working on new funding approaches, which talk about appropriation, right? About an actual dedication of resources and government in a predictable way every single year for this fund. We're not there yet, but we remain hopeful, in spite of all evidence to the contrary. But we do remain hopeful that the VOCA pot of money is going to be restored. Other federal sources are being either flatlined or even cut when the need is increasing, and our programs, who employ a lot of people, are continuing to pay those people. Health insurance is going through the roof. These folks drive around, right, the state, because they serve multiple areas. And, I don't know if anybody's filled their gas tank lately, but it's not fun, right? I bought a hybrid, and I was like, oh, great, I'll never buy gas again. Oh, guess what? I do still buy gas, but it's terrible, right? And so our programs are seeing an increasing level of their costs, of course, with the federal funding either flatlining or going down. And then this last item, is just kind of a reality, right? It is April 15th, and a week and a half ago, the people in Congress who represent us passed their federal budget. Does anybody, this is a super extra credit question, does anybody know when they're supposed to pass the federal budget? Say it again? No, that's a great guess though, not January 1. Even worse than that. We're in October 1 fiscal year in the federal environment. October 1. So how about that? So Indiana has a July 1st fiscal year, and the feds have an October 1st fiscal year. I mean, it's just an adventure every day trying to figure it out. But we didn't have a federal budget from October until 2 weeks ago, a week and a half ago. So that's kind of a problem. And what that meant was that many of our programs, including us, did not get our federal appropriation for the various things that because they weren't working on getting money out the door, they were working on figuring out what the budget was going to be. Now that's kind of a problem, right? And so that's, an issue, and it makes it just really hard. Obviously, we want to help people when they come in the door. Obviously, our programs want to be responsive to the need, and we have to have resources to do that. Other questions about the federal environment? All right. So the state environment. We have one dedicated state appropriation, the Sexual Assault Victim Assistance Fund, or SAVAF, because we have to have acronyms for everything. And so SAVAF is not a lot. So in 2023, we went over to the legislature and asked them if they would give us more, and they doubled it, so not a lot. Doubling not a lot is still not a lot. It's $4 million for the entire state of Indiana. Not a lot, but it's better than nothing, right? And one of the things we're going to do in the budget session, which is this next item right here, is to go ask our legislators if they would help us fill in the hole that is VOCA, which is the previous slide, right? It's Victim of Crime Act. It's about a $26 or $7 million hole, which, I mean that's a lot for me. I don't have it in my bank account at all. But the state spends a lot more on various things. So it's not impossible to imagine that they might do something to help us fill in the hole. But we'll see. Right? If anybody, if you follow kind of the state government situation, they misprojected, or I don't know, $1 million, billion with a B, billion of Medicaid funding. I don't know if you've heard about all this. So that's kind of a problem. And so there'll be a lot of discussion at the legislature in 25 about nobody gets any more money until we figure out what we're doing about Medicaid, which I believe to be important. Don't get me wrong. Medicaid is essential government service, right? And we need to provide that to people. So that's our state environment. Are there questions about that? Please.
What is this, SAVAF? What's this?
to our programs. We get a portion of it, they get it too, and they can use it on any victim service. So I should probably back up and say that our service providers do all kinds of services to our victims. Advocacy, legal advocacy, they do hospital and healthcare advocacy, they do, many of them do individual and group therapy, many of them contract that out because another problem we have in Indiana, you may know, is that we have few mental health professionals. And so they do provide therapy, most of them do not have a therapist on staff. They provide other kinds of social and emotional supports, and then housing assistance and all kinds of other things that survivors need. So that's the way that money is spent. Staffing, primarily, but other things too. So, but when you run an organization like this, the Family Justice Center of South Bend is yours, and they're really, really good. So that's the good news about this area of the state, really, really good at their jobs. And they take these funding sources, various ones, federal, state, and they kind of figure out a matrix of how they spend the money to support survivors. And it's really complicated. Any other questions about it, please?
So I'm just curious, I've seen a lot about the victim services or the response side.
Yes.
I'm wondering if there's any additional advocacy or funding around funding for prevention.
Prevention. It's a great question. Thank you for that question. Well, the answer is we do prevention. Our programs are all required is the wrong word. They are permitted to do prevention with both the SAVAF money and with some of the federal money. And prevention is not increasing because there's no additional resources for that, but rape prevention education is one of the CDC funding lines. It's supposed to be increased, we'll see. But yeah, prevention is a line of business, if I can put it that way, that we in our programs do. It's mostly in the high schools. It's not as wide and broad as it needs to be. I mean, we've got a lot of high schools in the state of Indiana, and it takes a lot to do prevention training in that environment. Other states in the country do a much better job than we do at prevention. We just don't have the resources, and most of our programs don't have the staff, to go into every high school and to provide this kind of programming. You had a question?
Sorry to back up just a little bit.
You're fine.
Do you have a dollar amount attached to the 40% deficit for the voter fund?
Yes.
How much is that?
Yeah, so like everything, it's complicated, but the 40% cut represents about 17.8 million in Indiana. That's 40%. So if you like algebra, which I do not, you can figure out that 40% of the whole pot is how much the whole pot is. Now, since 2018, which was kind of the high water mark for VOCA, for all kinds of reasons that are outside of any of our control, Indiana was getting about 48 million. So we have been getting less and less over time, right? And so restoring the pot to 48 million is going to be a whole lot more than just 17 million. And so our communication with the legislators is like 17.8 million is the 40% cut. We would love to restore to where we were in 2018, but they're probably not going to do that either. So this is kind of where we are as far as the dollars are concerned. So back to your question, prevention is obviously really important, right? I mean, wouldn't it be lovely if we didn't have to spend money on response and all, I mean, forget about the money. Imagine how much heartache and trauma we could avoid if we had meaningful prevention. Absolutely true. And I guess part of the problem, frankly, and I go to a lot of national meetings, there aren't a lot of evidence-based curricula that are working. And it's hard to measure. I mean, some of you are academics. I mean, we're in this lovely institution of higher education, right? So how do you prove that it's working, absent the other factors? I mean, I said a minute ago that we've seen a dramatic increase in interpersonal violence in the high schools. That is a really complicated problem, and I don't know why. But if we did prevention, trying to figure out whether that's making an impact is kind of a long game as far as research is concerned. And nobody has any money for that. So I wish we could do meaningful prevention. I think many people who work in this space will say that the wheel of oppression, sort of the cycle of violence as it relates to our society, starts with the objectification of people, right? And that's a real complicated problem that leads to the sort of justification for violence of all kinds, and then we get into sexual violence, which is a power dynamic in sometimes in relationships. So that's not a very satisfactory answer, but that's what I've got. Who has other questions or comments for me? I really appreciate all your engagement. It's been really helpful. I understand and I appreciate, we have almost no service providers that are serving these populations. We have rural areas in Indiana, there's no question about that. But our rural providers don't even have enough money to serve the people that they are serving. And to get grants to do rural engagement, it's really complicated, and they don't have the staff to do it. So we don't have indigenous, we don't have recognized tribes in the state of Indiana. I'm gonna get myself in trouble. We have one that doesn't have population center. So I'm looking at you because you probably know more about this than I do. There is a Bureau of Indian Affairs, or the group of Indian and state, and they say that we have a recognized tribe, but we don't have population centers. So we're not eligible for this grant fund. That's the sum total of what I know. I know we have indigenous people, I know we are on indigenous land, I understand all of that, but in order to have access to these funds, it has to be a population center of indigenous people, which we do not have in Indiana. So, there's some other things that are coming down the pike. We want long-term funding for prevention. Right now we don't have it. We're talking to the feds about that. All right, let's stop talking about money because it's just depressing. Let's talk about something else. In our work, we have something that is written into statute in the Indiana Code called the Sexual Assault Response Teams. They are required to be in every county. They are required to be focused, to be created and run by the prosecutor. They are required to do various things. And I keep saying the word required, yes, because this is Indiana, and some of our prosecutors are really trauma-informed and victim-centered and care a lot about this. And some of them are not. Now, the good news in St. Joe County, does everybody here live in, no, not you live in Chicago, so not even in the state of Indiana. So if you live in St. Joe County, the good news for you is you have a really good prosecutor, whose name I can't remember, who is very active in this movement and has got a SART, and he stood it up, and he's really doing a good job. And it's a he, because that's a thing. Now, there are other places in Indiana. Marjorie, is that where you live? No, that's another place.
And no one makes the prosecutors have a start.
You are correct. You are correct. Interestingly, the legislature is famous for passing laws with no teeth whatsoever. It's like, you have to do this, or what? And there's generally no well. Depends on who you're talking about, right? The prosecutors are very powerful as a lobby in Indiana, and they go over there and they're like, yeah, you can make us do this, but you can't do anything to us if we don't, because we don't feel like doing so, or whatever. And so there is no teeth. We don't have any recourse. Individual citizens don't have recourse. There is no teeth. Now, what we have done as a coalition in the 2 years I have been there is one of our responsibilities is to assist in the creating and the establishment and the working of these SARTs. We have a great map that Alexis, my matter of fact, let's go to the map. Let's go to the map. Wow, what do you know? There's our map. I'm so proud of this. Alexis is our coordinator of the SARTs. She has done unbelievably good work. When we started, this was our map. And we did the red, green, and yellow, and the whole thing, like the stoplights, and whatever. It was all kind of a big mess, and we didn't know what was going on in the red, then the yellow was kind of, I don't know. They'd say, yeah, we got to start it straight. And well, who's on it? When do you meet? How does it work? Not really forthcoming. And then we had some, we don't know what's going on. People wouldn't return our phone calls. It was just a big mess. So then, last fall, Alexis has just been doing so much good work. And the Prosecuting Attorneys Council, who is one of our colleagues in this work, told us that the red makes people feel, makes them feel bad. I'm not making this up, I swear to God. These are grown people, mostly men, who carry guns and drive around, and it makes them feel bad when we have red on the map. So I almost laughed. I thought she was kidding. She was not kidding. And so she said, you have to change the colors. Okay, I'm easy. So we'll change the colors. So we'll go to blue, light blue, or dark blue, and all the rest of it. So we got different colors, and we made some progress. And then we went to their conference in December, and we sat at a table, and we had the map right there. We couldn't bring this map because it hurt their feelings, so we had this map instead. And we're like, hey, where are you from? Find yourself on the map, prosecutor. What do you think? And that got some attention real fast. Shame is a powerful motivator. So is praise, right? Those of you who teach, and I teach, you obviously give positive reinforcement. So we gave positive reinforcement where necessary. And now look at our map. We prosecutors, and when there's credit to take, they never want to share it. When there's blame, they have no idea what you're talking about. So having a regional SART is great, except it does permit somebody else to take the credit for the work that you're doing. So that's kind of a hard sell. But we have created some. They have created them with our assistance and our support. So that's what's really important. So why do we care about SARTs? Well, SARTs bring everybody to the table, and they require communication, collaboration, and victim-centered, trauma-informed behavior on everyone's part. And they work really well. Please.
On the last slide, is St. Joe County not going to start?
St. Joe County. Where is St. Joe?
Very active.
There you go. Isn't this you right
Oh,
here?
no, it says active. It says active.
Active. Life little.
What's orange?
Well,
I mean, I don't know what color it is.
yeah, I'm sorry. It says unknown. Bah, 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 bah. That means they wouldn't call us back and all this. We're gonna get rid of orange because people don't like it. So
And then
please.
the ones that have like more of the consortium of
Yeah,
the
regional.
Is that based in what kind of population, like
No.
maybe they're less dense? or-
No.
No.
Totally voluntary. Totally voluntary. What we would say to a prosecutor who didn't have this, didn't want to do it, was like, yeah, I'm busy with guns and, drugs and stuff. Which is real. It is. It's real. Or they'd say to us, we don't have any sexual assault in our county. Oh, that's my favorite thing. We're decent people. We don't do that here. Okay. So when they would say that, I would say, here's what you can do. You can join with a prosecutor who might be right next to you, like down here. This is Vigo Sterhope. This is Clay. This is what's down here, Alexis. Sullivan. Yeah. So Vigo's got a pretty good prosecutor, and these guys were like, yeah, we don't really do this so much. So we're like, great, make a regional SART. It's lovely. They just decide. It's an option. It's a way we can get this work done without having to, beat people over the head when they're not willing to do it. So this is our SART map. It's important. We don't have any teeth. We talked about that already. But we are working on our charm offensive instead. And some of you may be surprised to hear that that's kind of working. I mean, Alexis is doing it because, yeah, my charm is a lot less effective than hers. Do you have any questions about this? All right, we've made really good progress. This is not legislative progress. This is more local government progress. And this is part of public policy, and it's important. And it is the hard work and the long game. And what we know, of course, about prosecutors in Indiana, they're elected either every 4 years. We have prosecutors for life in Indiana. So some places have had the same prosecutor for 16, 18, 20 years, and then they give it to their son. This is really a thing, I swear, it's the craziest thing. And you're like, oh, prosecutor whoever, you're really young now. And you're like, yeah, it's my dad. Okay, great. So that's a thing. So we can have them for a really long time, but sometimes some counties have new one every 4 years. And so that gets, you work really hard, Alexis makes the calls and goes to the meetings and gets the people, and then that person either loses or doesn't run. Please.
So does that mean if they're for life, they have to step down, there's no election until they?
No, what I mean by that, I'm sorry, I should clarify. They do not have term limits. They have to keep running,
But there's no term.
but there's no term limits. Right. We also have mayors for life in Indiana, which is confusing, but that's the way it is. Yeah. Other questions about all of that? So this is public policy in its more local form. Now let's talk about some state stuff. We are working on the rape kit backlog. Tonight you are going to hear from the eminent expert in the whole country about rape kits and what to do. Because we discovered as a country some time ago, 15 or so years ago, that there are all these warehouse rape kits. Now, when you think about why we test rape kits, right? Okay, I'm going to ask you, why do we test rape kits? DNA, right, and what do we do with that DNA?
Matches to the perpetrator.
Correct, and then what do we do after that? We go to court and we prosecute people. Right, and so if it's been 15 years since we discovered this about 15 years ago, some of these kits are very, very old. Right? And even if they can be tested, which some of them could not, why would we do that, for instance, if the victim doesn't want that to happen or the perpetrator is passed away or in prison? Why would we do that? Correct. Other victims, so this is a serial kind of rapist situation, perhaps. The only way we would know that is if we tested the DNA, right? And so doing this is really important. And the other thing about interacting with the victims, this is hard and this is complicated. And I know the prosecutor you're going to hear from, Kim, this evening. I hope someone will ask her, how do the victims feel about it? Because, 45 minutes ago we were talking about how hard it is to go through the process. And many, many victims, for all kinds of reasons, do not want to go through the process, or they did that, and the perpetrator either pled guilty, or was convicted, or was in prison on some other charge, and then they thought that was it, and I'm moving on with my life. Imagine getting a call 20 years later. It's like, hey, we found your rape kit. What do you know? We're going to test it, and it's going to be great, and we're going to find other victims, and it's... In what world is that great for me? And so this is really hard, and it requires a real thoughtful approach. Thoughtful, and thoughtful is not always the word we use when we talk to law enforcement, right? Again, law enforcement, very, very linear. Identify the bad guy, take the bad guy to court, put the bad guy in prison. And then in between all of that, there are a lot of complications that we talk about. So we are trying to get some work in this way in Indiana. In 2017, we had a voluntary legislative approach that said, we're going to ask you nicely if you would please test your rape kits. Some jurisdictions did that, some did not, and we saw some successes there. Joyful Heart Foundation is a national not-for-profit who is working on this problem in the whole country. And they are doing sample legislation and providing some assistance and support to try to get that done. So that is one of the things that we are working on as it relates to structure. And by the way, we talk about rape kits. They are obviously evidence collected from a victim. It has to be within 72 hours or it's not useful.
120 hours.
Excuse me?
120
120 hours, thank you. So, many victims do not submit to this for all kinds of very legitimate reasons. Very legitimate. And then some of them do submit to it. They can do it in an anonymous way so that the DNA is really utilized to find other victims, as you said. So again, the nuance of this process is really important. Please.
Not to play that counter.
Go right ahead.
Here's my other issue with the whole backlog rape kit testing, which absolutely needed to happen. But now what we've created is a 4 to 6 month delay in kit testing.
Yes.
And a lot of my patients, they don't know if they want to go forward or not because they want to go forward based upon is there evidence in their sexual assault.
Is there something that can be collected? Yes.
Well, I mean, I'm going to collect it, but they won't have the answer of whether, so, of course, the detective wants to interview them within a couple of days, and the prosecutor, and then they present their case within a couple of weeks, and then they want to know, do you want to go forward, do you not want to go forward? How can they make that decision when they don't know what's in their kit yet? They have no idea whether they've gotten a hit or whether they haven't gotten a hit in their sexual assault kit, and they won't know for 4 to 6 months.
Correct.
So, we're in like a really bad situation as far as the sexual assault kits go.
Yes.
Really bad.
Yes, we are. You're a clinician.
Nancy, why don't you tell the room who you are so that
You're a
it
doctor.
can be helpful?
You're a clinician.
No, I'm a forensic.
You're saying?
Yeah.
Yes. At which hospital?
St. Joe Medicine.
Thank you for that work. It's really hard. So I don't know if y'all heard that. It was really important, so I'm going to try to summarize it. The notion that the backlog at the lab is creating this situation where a victim will have to wait or wants to have clarity based on what the kit resulted in or what's the result, what the kit shows us. But you can't have that clarity because of the backlog. Absolutely true. And this brings up a public policy, which is my topic today, issue of if we're going to do this, which is go to the state and talk about some sort of state, where's my state law? Here we go. Yeah, we're trying to get legislation. We've got to put money toward it to make sure the lab can handle the process, right? Because this is, at every level, law enforcement, sane nurses who work in our hospitals, and then the lab, right? And we have a backlog in our lab for everything from blood alcohol to everything else. And it's a real problem. And Marion County has its own lab. We're the only one, actually, and we're kind of lucky, although we have a backlog too, so it isn't great. And yeah, testing all the kids, and people say, well, we shouldn't test them all because, we got to triage the ones we're testing, especially the old ones. And these are all really important questions that we've got to grapple with. And thank you for that perspective. It's hard. Please.
What is the backlog in Marion County?
Well, that depends depends on who you ask. They are not forthcoming about the answers now. So there you go. And one of the challenges here is if we start talking about let's do an inventory, who are we going to ask, right? There are all kinds of, the process, and you know a lot, more about the process. But you go to the hospital or a clinic. There's a great clinic in Fort Wayne, actually. It's not standalone. It's not part of a hospital. And you get the kit taken, and then law enforcement's required to take it to a lab to get it tested. Okay. And sometimes that doesn't happen as promptly as it's supposed to, or at all. And so sometimes we find that there are kits in people's property rooms, next to the guns and the packages of marijuana and all the rest of the stuff that's in the property room, right? And so that's part of an inventory. But then there's an inventory at the lab. We have a state lab, and then Marion County has its own lab. And they're not saying how many we have, just to be perfectly honest. There's none.
Isn't part of that triaging is what helped create that backlog?
Yes. Yes. The backlog's been a complicated problem.
They threw a bunch of dollars at it at first.
They did.
And so then they kept up. Like that, I've been doing this for 21 years. It used to take about a month to process a kit. Like you would turn the kit, and once they received the kit, it was about a month. And then we were all fearful when, all of the kits went down. We were all fearful that it was going to put everyone behind. It didn't at first because they threw a bunch of money at it and a bunch of extra help and everything to keep up with it.
Yes.
Now, the law is still that all kits besides anonymous kits are getting processed, no matter what. And so now we've taken the dollars away from it, and so now we're just continually falling behind. So
Yes.
the last statistic I got from a detective was 4 to 6 months before they get the results back of the kits.
Now, what Marion County has done, they got some federal money through this thing that is called the Kit Testing Initiative, SAKI. This is something, there's a thing, federal money coming to the Department of Justice. And what Marion County is doing is they are sending them out of state. Because there are 2 or 3 labs in the country that specialize in this kind of testing and this kind of testing only. And so we are literally mailing our kids, the old kids, and then they're coming back with the results after that whole process. Because our lab is behind and the state lab is not available to us because we have our own in Marion County. So,
Who pays when they mail them out of state?
well, in that particular case, the Department of Justice is paying through a grant. But I don't know how long, it's not my adventure. So they have the grant for a period of time to do this for a number of kids. So,
Not that I'm advocating for this, but there's no private market for this, there's no business to come in and say.
The labs-
You can pay to get your test.
the labs are for profit, and we enter into contracts with them. So there is a private market for this. It's just the logistics of figuring out which kits we're going to test, and then literally mailing them, and then waiting for them to be mailed
And
back.
I wasn't advocating.
No, I understand. But that's in existence. It is. All right. How am I doing on time, Alexis? I'm not doing very well on time. Okay, I'm doing terrible on time. Okay, so this stuff is important really quickly, and then I will jet through it. I promise. I know you need a break. We had success in the legislature, so good for us, right? This is really kind of rare. We have clarified but not defined consent. And 11 other states have actually defined consent. We are making progress. This is in the sort of victim center. This is the Indiana rape law. The yellow highlighted is the new language. This was in 22. It didn't used to be true that there was any clarification about a person's behavior as it related to consent. So you either had to say, I do not consent to this, or there would have to be some kind of force or threat of force, meaning you were a gun, a knife, if you were being brutalized, or they couldn't really prove it. This is an issue for the jury. And so we added this language, and now it is able to be used in front of the jury. Now, you're going to ask me, and I'm going to answer it. We don't know yet what the impact has been. I asked the Prosecuting Attorney's Council how many more cases they're bringing around the state because of this, and we are not getting very much data on that. It's probably the long game. But this is something that we can now utilize in court with these kinds of cases. All right? I'm going to really jet through. Statute of limitations. We need to fix the criminal statute of limitations. Forget about the civil one for right now. Criminal statute of limitations is really short in Indiana. Almost every other state in the country has done something different. We are really short. So rape 3, which is, forget about a minor victim, that's a whole other story. But with rape your run-of-the-mill sort of regular rate, it's terrible to say that, but for our purposes, that's what I mean, is 5 years. There's no statute of limitations for what's called rape 1, which was with an aggravator, a gun, serious bodily injury, in the commission of another crime, like kidnapping, those kinds of things. So we tried this past year, 2024 legislative session, to get it removed for rape 3. We did not succeed. We are going to a summer study committee, and I will keep you posted. So we think we might have some luck next year. We'll see. We'll see. I don't have time to talk about abortion and reproductive rights. I know where I am. I was advised I shouldn't talk about this at all. But this is important. I know Liz laughs, and that's good. That's helpful. This is important. Survivors who find themselves pregnant as a result of the rape, which, by the way, the CDC says 1 in 7. 1 in 7. All right, that's a new statistic. It came out in the summer of 23. 1 in 7 need a full complement of reproductive options. Okay? And so the legislature in the special session of 2022 came up with these 3 narrow exceptions. 10 weeks fertilization for rape and incest. Now the good news, if I can say that, and there is some good news, is that our law does not require the victim to report to law enforcement. There is a very specific example. When I was over there lobbying for this, I said, look, rape, incest and rape survivors need an option that does not put requirements on them. It had nothing to do with funding. It was just about getting reproductive access, access to reproductive care. And so it does not require that. Other states have done that. It doesn't require you to sign an affidavit under the penalty of perjury, so we're going to criminalize victims. Other states have done that. We did not do that. So it could have been worse. There is no restriction on travel or assistance to abortion care. It does not impact the morning after birth. The AMA did a study just within the last month or so, 64,000 rape-related pregnancies in the country. 64,000 in states that do not have access to abortion care. So I'm going to let that kind of wash over me for a second. So this is a state. I'm going to provide all this to you. You guys can look at this. This is a map. Here we are. We're terrible. We are the most restricted in the country. So I'm sorry?
Not the red.
Well, right. I mean, because that hurts people's feelings. So we're not doing that. So what do we do if we don't like any of this? Well, there are things we can do. Find out who your legislators are. You can find out who your elected officials are. They have a really good website. Legislature doesn't do a lot that's really good, in my opinion, but they have this great website. You can find out who the people are who are doing these terrible things, and you can call them up, and you can see their pictures and stuff, so that's helpful. And then some of our counties have really good websites. Some of them really don't, but that's a way. For instance, find out who your prosecutor is. Find out who your mayors are. And then once you find that out, go talk to them. Go talk to them about this problem, about whatever problem is on your mind. And then make sure that you partner with other people. And then you got to vote. But that's just the bottom line, right? I don't know what even to tell you, right? These people are elected. They care about who votes for them and who doesn't. So that's what you got to do. And here are some resources that I'm going to provide to all of you. I'm out of time, which I knew would be true because I just can't help it. Who has questions for me or comments? Okay, well, great. It's been a privilege to be with you. It's been wonderful to hear our discussion. I'm available. We're going to provide these slides at all